Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating guest. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hi, my name is George Korfias. I'm the founder of Partner in Care. I'm based in Victoria. I started this company back in 2019, where we basically wanted to create an organization that could provide NDIS services to participants. I'm originally from Northern Territory, born in a town called Nhulunbuy, and then moved to Melbourne about 11 years ago. So it's basically my passion to provide high quality services to participants. And so we started Partner in Care in 2019. It was a journey that I really was passionate about, and I wanted to create an organization that could assist people living with their disability to help them with their daily living and also community access as well. So basically, it started as an idea of providing private care to participants, as my older brother was diagnosed with multiple myeloma, and that was very hard on the whole of the family as well. So basically, we seen that there's a lot of patients in hospital that didn't have a support system as well. So we came up with the idea of providing services to people in a private way as well, that basically have someone there to support them as a support system. And then the idea came about doing an NDIS provider as well. We also was getting some feedback of people as well, that they were experiencing some issues with having support workers and things like that. They're having a bad experience as well. So we decided to create Partner in Care and to become a high quality provider that people can trust as well. Then we obviously started to research the NDIS for a few months and found that there is a need for a provider that is caring and can provide high quality support workers as well. So we got our first client in Broadmeadows. And then from providing really good support staff and the feedback we're getting from the community as well, we obviously started to get a lot of word of mouth in the community as well. And then we started to grow. After 2019, Partner in Care was growing. We now have clients of Victoria wide as well. And we also have clients in WA and Queensland as well. So obviously, I'm very proud of the organization that we built as well. And we obviously, we're proud of the work that we're doing, the great satisfaction that we're receiving from clients and feedback as well. And we wanted to create an organization that has great people involved. We're working in the community. We're assisting people with a disability to obviously to become independent and to achieve their goals as well. I'm very passionate about helping people, making sure that we're looking after the most vulnerable people in our community as well, and that we can provide a service that matters, that makes a difference in people's lives as well. And so we have a lot of great feedback coming from the community as well. And I just wanted to share my story and share the journey that we've been through as well. I'm really looking forward to many more years of satisfaction, helping more people, assisting people out there that need that support system as well, and that can obviously achieve some goals and become independent as well, which is what is really what we're about. Having diverse clients as well is really good. Listening to their story as well, and just being empathetic, and obviously trying to help them as much as we can as well, because it's obviously a great scheme, the NDIS that we have in Australia. It really helps people to become independent as well. So I'm just happy that we can be a part of this, the scheme that's in Australia with the NDIS, and I feel that we can help more people along the way as well. And so that's why now, at this present stage, we have grown in a positive way as well. We have great connections in the community as well, different people that we've obviously helped along the way. But personally, for myself, is the great satisfaction that I get from this work that we do. It's super important, obviously, that we're helping, assisting people living with a disability, and making a great contribution to the community as well. So that's why, obviously, I'm very proud of the organization that we've built, and I just want to keep going in the future as well. I'm sure we're going to have some great stories come out of what we're doing as well. It's something that I've enjoyed working along with different people from different backgrounds, cultures as well, understanding them as well, and having that sort of compassion as well. And that's why Partner in Care is a great organization as well. We have so many feel-good stories from participants that have achieved their goals as well. And that sort of makes me, knowing that we're doing a fantastic job with everyone, it's that satisfaction that I get from helping people and assisting people as well. And just my personal experiences that I've had as well. I have a really great family support network, and I respect people as well. I enjoy being with people and talking to different people as well, and that's why I feel that my skills is put into work, and I really enjoy being out in the community, meeting people as well, and contributing, in a positive way too. I feel is what we're here for in the NDI space as well. We obviously have had, our ups and downs as well. It is quite difficult to run your own business as well. But if you have a dedicated mindset and a positive mindset, I think that you can achieve anything as well. It's just about going through the different stages, and going through hard times that you're going through. But in the end, we know that we are doing a positive thing in our community, and that's why the reason why we created Partner in Care, is to obviously provide high quality services to participants Australia wide. And my aspirations would be to be nationally as well eventually. Me and my brother Nick, we're very dedicated and hardworking people, and that's why we've been going so well at the moment in the industry. And I just want to keep going until we can achieve our goal and our vision as well as an organization. I feel that we've pretty much at that stage where we can pretty much talk about how great our organization has been, how proud we are as well, and looking forward to a great future for everyone. And I'm just really excited for the future, what it holds for us as an organization. And yeah, it's a journey for us, it's a journey for our participants and our support staff as well. So that's a bit of our motto is, come on a journey with us with Partnering Care as well. So yeah, I think that I'm really excited to see what the future holds for us. But yeah, basically, I put my experiences in there, with my obviously as a person, what skills I'll bring is really great as well. So yeah, that's just a bit about my story.
Wow, George, it's amazing what you have done from your personal experience with having to support your
Yeah,
brother,
yeah,
that this turned into a business that's now impacting
yeah,
on many people's lives.
yes,
So, how does Partner in Care Australia
yes,
integrate its commitment to inclusion and excellence into its
yeah.
daily operations and service delivery?
Yeah, so basically, how we do that is having an open mind, and obviously with our participants that we're looking after, is to give them the autonomy to choose their supports. Okay,
Mhm.
respecting obviously their cultural beliefs as well, diversity, and giving them that choice of control to basically choose the supports, choose the person that is supporting them in their journey.
Right. That's
Yeah,
awesome. So,
yeah,
what are the key strategies that you employ to support individuals with disabilities in
yes,
leading independent lives and engaging within their communities?
yeah, of course. So basically, what we do is we listen to our participants. So
Hmm.
basically, having open communication with our
Yeah.
participants is very important here, because we want them to achieve their goals. We want them to let us know what it is that they would like to achieve in a long-term perspective as well. So it's very, very important here to listen to their views, and
Hmm.
give them that autonomy to choose who they support them. Obviously, how will they be supported as well, but also if they have any cultural requests or beliefs, then listening to that to make sure that the support staff are a fit, and
Hmm.
also that we pretty much tick all their sort of requirements of supports as well.
Okay. Now, that is going to
Yeah.
be my next question is how do you
Yes.
ensure cultural competency and sensitivity amongst your staff when
Of
providing
course.
services to
Yes.
diverse clientele?
Well, I think it comes down to training as well. It comes down to organizational training on, cultural sensitivity with participants, but
Yeah.
also for us, it's making sure that we get the information from the participant. So making
Hmm.
sure that we write down on through our documentation and support plans,
Hmm.
that we get that information about cultural sensitivity and what they're looking for, because
Yeah.
it's all about the participant here. It's not about us. Like, I think that it's centered around our participants. So if they communicate that they want a certain worker with cultural backgrounds and beliefs, then we
Mm.
obviously must sort of provide that with them. But also, like I said, cultural training as well is really good for all staff that are involved, because we live in a diverse community. So, I
Yes.
think training is very important here for all our staff.
Okay. So, what are some of the unique challenges that you face in providing in home health and
Yep.
personal services, and how do you
Yep.
address them?
I think some of the challenges is um, there's a lot of sort of miscommunication in the industry.
Mm-hmm.
There's a lot of ways that participants sort of get lost in the system as well,
Mm-hmm.
because it's such a very complex NDIS is very complex as well.
Mm-hmm.
So there's a lot of different sort of barriers in the way. Now that could be with family members in there as well. It could be that that participant does not understand the NDIS and how it operates as well, and what it can do for them in a positive way as well.
Yeah.
So not only do we work with the participant, but there's also other parties involved that sometimes can put a barrier in between us and the participant, because the main thing that we're trying to achieve is for them to become independent and to access the community for social community and participation, so they can
Mm-hmm.
obviously make some relationships, become more socially awareness, but so for their social benefit as well, to meet people as well. But I think that it's very hard to be an NDS provider. There's a lot of blockages sometimes in the way that
Mm-hmm.
obviously, but I think our focus is more like with the participant. And so I don't really focus on the outside things that are happening out there. I think
Right.
really focusing on what partnering care can do for someone is very
Mm-hmm.
important. And obviously achieving some goals is what we would like as well. But the thing
Yeah.
is, the great thing that every participant is unique. So we
Yeah.
don't just put someone in the same basket. We
Mm-hmm.
we take it slowly. We will try and ask them, what would you like to achieve? Because it is up to the participant to achieve these goals. So that's
Yes.
why we have an open mind, with our participants.
So, how do you incorporate the views and feedback of clients and their families
Yep.
into the care and support services that you provide?
Yeah. So basically, we will get a lot of feedback from clients and families as well. And
Mm,
how we implement that is through strategies that we will try and comply with our support staff. We will
right.
communicate a lot of that feedback to our support staff to better
Mm-hmm.
provide a service towards our participants.
Right.
We will try and obviously let them know that they're doing if they're doing a fantastic job, if there is positive feedback, we will let our staff know to keep up the positive work they're doing.
Yes.
But it's all about, it's just about chatting, like talking with everybody about the feedback. If there's any issues at all, we can
Yeah.
obviously try and better our service by letting our support staff know about the feedback as well, and
Yes.
and making sure that everyone is on the same team, same page, to
Yes.
provide those good services. And so for us, it's all about feedback, because we can actually better our service. That's a great thing about getting feedback, is that we
Mm-hmm.
can better our services to improve them, because there's always room for improvement. I think,
Yes.
no one's sort of perfect. We can improve our service, and that is by giving out feedback forms, listening to our families, participants as well, and passing that information on to our support workers. And we can
Yes.
also better train them as well. So there's a few options there that we can obviously implement through our support staff.
Okay.
Yeah.
Now, the word disability covers a
Mm.
wide range, a very wide spectrum.
Yes.
Can you describe your approach to maximizing the independence and functional skills of participants in your program?
Yeah, yeah, of course. So basically how we do that, because there is a lot of, like I said, there's a wide range in the word disability as well. So
Yes.
what we'll do usually is we will try and get our support staff to start writing down goals. We will start our support workers to sit down with the participant and ask them about their aspirations for the future as well.
Right.
So obviously, writing down goals, forming a bit of a plan as well is what we do here. So any skill development that the participant would like to achieve,
Yeah.
we will sit down with our participant and form a support plan. In
Right.
that support plan, there will be their goals that they would like to achieve through their NDIS plan as well. And we also work with allied health people as well. We also work with other people that are part of their care journey as well, into implementing any skill development, or any goals that they would like to achieve, in their time with us. So we will get support staff to assist them with that. And step by step, they will start to achieve some independency, which is really good. It is a slow process. It's not something that can be done, in a quick sort of timely manner. So basically, we help them with shopping, with appointments. We will help them inside their home as well. So if they would like to be independent, the support worker will assist them with that as well. There's things like teaching them how to take public transport. There could be instances where they want to help with their finances or learn certain different aspects as well. So there's many things that we can do to help the participants to achieve their goals.
Okay. Now, how did the COVID pandemic affect your business and your services? And what adjustments did you have to make in response to this?
Yeah, of course. Yeah. So basically, back in COVID, it was difficult for us, but because we are, because we're in health and the health service sector, we were still able to trade, but we had to apply by all the health regulation rules back in when the lockdown was happening. So we basically had to have permits for our workers to go out and provide services to our participants, and that is sanitizing, wearing a mask, and also COVID testing as well. So it was difficult because it was a roadblock for the participants as well, because also you had to be vaccinated as well. Okay, so there was a bit of issues with participants accepting workers during that time, because they were afraid of COVID and the whole media, and obviously being such a big, it was a big pandemic for everyone. It did impact a lot of participants' lives. They obviously didn't have services. Some services couldn't be provided for them during that time as well. So we were still operating, so that was the good thing. But we still had to abide by the health regulations in Victoria. So it was a bit of a hard time for us, for our staff, but also I think participants also had quite a difficult time during that time, because a lot of participants were quite scared to have workers come through because of the fact of COVID, so they didn't want to have anyone. So that means that they weren't provided any support. So it was pretty hard during those times, definitely.
Very challenging.
Yes.
So what are your future goals for Partner in Care in terms of growth, service diversification,
definitely,
or impact?
Yeah, definitely. So our goals for Partner in Care is we would like to expand nationally as well. So we want to be an organization that is just absolutely amazing, that provides high quality services to participants as well. So, for us, it's just about having great satisfaction as well. And also that word of mouth in the community is very important for us, being a good provider. So that's our dream and our aspirations, is to grow nationally as well, because we want to be the best provider that we can in this industry as well. So we feel that we have the tools, we have great people. I'm very passionate, and I'm very driven in what I'm doing at the moment as well. And so, we just don't want to provide care services. We actually want to do allied health in the future. We also want to do accommodation in the future as well. So your short-term accommodation, SEAL as well. So just growing the business in stages is very important to us. But that sort of, nationally would be our dream as well. And being Partner in Care's name being everywhere is what we strive for as well. So I'm very optimistic about the future for us. And, it's going to be a great journey, and it continues on each year.
So, last question.
Yes.
Based on your experience,
Yes.
what advice would you give aspiring leaders in the in-home health and personal care industry, particularly with regards to diversity and inclusion?
Yep. I think my advice would be to be genuine in this industry, to have that sort of careness about people, and trying to create, organization that people are going to enjoy being part of as well. And just being open, being honest as well is very key here, because this is a person-centered role. So you're obviously going to be working with different people in different backgrounds. So being sensitive, but be aware of that person's different cultural and diverse needs as well. And maybe researching, have a look at different cultures as well, or, different people, because obviously you have to be quite sensitive, and you got to listen to your participants as well. But I think I think that genuine part is very important. Having a mindset of creating a business that everyone can be, be proud of as well is really good. And, just trying to better yourself, always keep going, and knowing that, it's not easy. You're always going to have roadblocks in the way. But if you have a genuine approach to people, you want to help them, you want to assist them, it comes from your family background, I suppose, because if I had a family member that wasn't looked after, you'd be upset, so you want to treat people like you treat your family at the end of the day. And, then you can obviously create a good business in NDIS, and just have the best of heart for people, I think. And you're doing a good thing for the community as well, not just what we're doing, but it's wider implications into the community as well, what we're doing. So my advice would be, hard work, dedication, and put your mind to anything, you can achieve your dreams. So
I love that.
Thank you.
Thank you so much for this interview. It's been fascinating.
Okay.
Coming into your world.
Yep.
The work you're doing is needed, especially with the disability community.
Yes,
thank
definitely.
you so much. And thank you to everybody who's tuned in today. The Diversity Connector is bringing you stories, voices from all walks of life, so we can share and celebrate our diversity, find solutions to the problems that are there. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. Thanks again, George.
Thank you very much. Bye-bye.
And that's a wrap, everybody, on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open, and definitely stay connected.